Hey Shannon, thank you for taking a few moments to talk with us today. Tell me a little bit about your headaches when you first met me.
I had headaches for years, pretty consistently on a daily basis. For at least 5 years, I had had an accident 10 years prior to surgery, and they varied in severity between maybe on a scale of 10, between a 5 and a 10. But on a weekly basis, I would have at least several level 10 headaches that would keep me down and inactive, kind of bedridden. I had a spinal cord stimulator placed at the cervical region of my neck, and that was on, basically I kept that on 24/7, and even with that spinal cord stimulator I was still having headaches daily.
Okay. And so you then came to see me and we determined that you could have had a traction or stretch injury of some of the nerves in the back of your neck. So we did a nerve block.
Correct.
A couple of them actually. And did that significantly improve your pain?
I did get relief from the nerve blocks.
Right. Okay. And so based upon that, we then went to do some surgery to release those nerves that we thought were entrapped in scar from probably your car accident. And what was your experience with surgery like?
Surgery was a little bit harder to recover from than I initially thought. I was down a little bit longer than I thought, but we had talked about that it was cool, that I had a lot of scar tissue, so I had surgery in that area before, so it was more extensive than I think we knew going into it.
Right.
But you know, once I got over the initial hump, it was all good.
Okay.
You know, lots of ice.
Right. And so now you're about 3 months
Correct.
following your operation with me. What are your headaches like now?
Minimal. Very minimal. I'm not using my spinal cord stimulator at all. I haven't. You and I talked about turning it off probably 2 or 3 days after surgery, which I did, and I haven't turned it on since.
Okay.
And I've had maybe 2 or 3 headaches, but nothing like the degree or levels or length that I was having prior to surgery.
Okay.
No tens, nothing that's kept me in bed for days or anything like that.
All right. And so are you happy at this point?
Very.
Okay. Now you say you have a little bit of hypersensitivity in the back of your scalp there. Is that right?
Correct.
And
There's a little bit of numbness and not liking to be touched in that area. But
okay. And is that getting better as time goes on?
it is getting better as it goes on, and I think just from my own experience in the health field, I think I know that's normal. When nerves are operated on, they
Right.
kind of get a little shocky.
Good. So would you do this again if you had to?
Oh yeah,
Okay.
definitely.
Thanks for talking with us.
Thank
Appreciate
you.
it.